The technical issues plaguing the Obamacare website rollout are only part of the problem. Many who've managed to navigate the system, gotten quotes, planned to sign up, are now saying no thank you. They're finding the Affordable Care Act is unaffordable, at least for them. Our Drew Griffin listened to some of their stories.
Christy Metzger and her husband Mark are both 29 years old, healthy, with 2 healthy baby girls and 1 big problem. Their health care company has informed them their current plan will cease in the next year because it doesn't comply with the Affordable Health Care Act. She needs to find a new plan. So Christy, a part-time teacher, and her husband, who owns a video company, went online. And after a week of trying, finally figured out just what kind of insurance she could get under the Affordable Care Act. And for her, it seems unaffordable.
And when I logged on, I was like, no, this is very bad. This is much higher than we were currently paying.
Their current plan costs $450 a month with a $5,000 family deductible. The bronze plan she found under healthcare.gov will cost her $650 a month with a deductible somewhere between $3,500 and $6,000. Christy says she has yet to find out if she qualifies for any subsidy.
It's very frustrating because we'd like to know for planning for the future.
Joshua Strickland, who owns a small business in North Carolina, spent 2 weeks trying to get on the Affordable Care Act site and couldn't, so he went to his own insurance company, Blue Cross Blue Shield, which was able to give him quotes for both his renewal under a private plan and his quote under the Affordable Care Act. The results, no matter which way he goes, he will be paying much more.
What I found was that the plans made available were almost twice as expensive.
His renewal under his current plan will increase by 9.8% to a monthly cost of $540. His deductible will jump too, actually doubling from $500 to $1,000. Under the Affordable Care Act, he says, the most comparable plan for himself and his 3 children is much worse. He was quoted $838 a month with a $1,000 deductible, and that is after taxpayers kick in a $150 per month subsidy.
You feel like we were told, number one, overall health care costs would come down no matter where you got it from, and perhaps number 2, the government cost, if you went on the Affordable Care Act, would be at least lower. And you're seeing increases on both ends.
That's correct, Drew. You hit the nail on the head with that.
Then there is 56-year-old Helen Cummins of Georgia. She retired early from an airline and now has a new government job making $24,000 a year. She has chosen to have no health insurance. If she currently needs health care, she goes to a hospital and pays the prorated cost for uninsured patients.
You must have been somewhat excited that you might get health care insurance.
Oh, my God. I was so totally excited.
When she finally got through, signed up, and found out she would not qualify for a subsidy or Medicaid, she learned her cheapest option under the Affordable Care Act between $357 and $387 a month with a $6,000 deductible. It's just too much, she says.
I was hurt. I was truly hurt because of the fact that I was expecting better. I was really expecting better.
The White House and the president himself has made it clear there are plenty of people excited about the plans, especially those with pre-existing conditions who are now covered and in many cases paying less.
And those who've already had a chance to enroll are thrilled with the result. Every day, people who were stuck with sky-high premiums because of pre-existing conditions are getting affordable insurance for the first time or finding, like Janice did, that they're saving a lot of money.
But the treatment still costs money, and the Affordable Care Act is dependent on lots of healthy people participating to make it work.
This doesn't work if we don't get lots and lots of healthy people signing up, because no insurance plan is going to work if you only get sick people signing up and the healthy people stay out.
It will all come down to the actual numbers the administration has yet to reveal. Drew Griffin, CNN, Atlanta.